If you're a teenager or a young adult right now, your social media feed is probably just flooded with these endless, super complicated skincare routines, right? You've likely dropped some serious cash on those massive Sephora hauls, just frantically trying to fix a sudden breakout. It's incredibly frustrating, and that pressure to find a quick fix is so real. But today, in this explainer, we're cutting straight through all that internet noise. We are completely ditching the influencer hype, and we're going to map out the actual, proven medical science and the official clinical guidelines for treating acne. So let's dive right in and look at what really works.
It's a question we've literally all asked at 2 in the morning while staring into the bathroom mirror. And you know what? That frustration of wanting an overnight cure is totally valid. It really feels like every single week there's a new, trendy serum or some magic patch popping up, promising you absolutely flawless skin by morning. But here is the reality. Those quick fixes, they usually just put a tiny temporary bandage on what is actually a really complex medical condition. They aren't curing your breakouts because they completely ignore the underlying science. So let's throw out the TikTok trends for a second and look exactly at the playbook doctors actually use when they tackle this.
Okay, first things first, let's define what is actually happening on your skin. The official medical term is acne vulgaris, and trust me, it is incredibly common. Acne lesions basically come in two main types. You've got your non-inflammatory comedones, these are your classic blackheads and whiteheads, and then you have the angry red inflammatory lesions. These can range from smaller papules and pustules to those deeper, way more painful cysts and nodules. Now, what's really crucial to understand here is that most people don't just have one or the other. Usually, it's a mix of both types of blemishes happening all at once.
Now, here's something pretty wild about how doctors actually judge how severe your breakouts are. They aren't just looking at your face and taking a random guess. They literally have to do math on your face and count the blemishes. Seriously, medical guidelines require this step to keep treatment totally consistent. If you have any number of blackheads or whiteheads, but up to 34 inflammatory lesions, or a maximum of 2 deeper nodules, that officially falls into the mild to moderate band. But the moment you cross that line to 35 or more inflammatory lesions, or 3 or more nodules, you move up into the moderate to severe band. And this isn't just about throwing labels around. This exact categorization completely determines the entire medical game plan your doctor is going to offer you.
And that brings us to a massive, game-changing number, 12. No matter what severity band you fall into, the standard first-line medical treatment is always a 12-week course. Not 12 hours, not 12 days, 12 full weeks. This is literally the foundation of the entire medical roadmap. Now, you and your doctor will jointly figure out the best option based on your severity, but your commitment to that 12-week time frame, that is totally non-negotiable if you want to see the medical science actually do its job. So let's break down how this actually builds into your specific treatment plan. If you're in that mild to moderate category, your 12-week course is usually going to be a topical combination, meaning creams or gels that you apply directly to your face. Typically, this is a mix of adapalene with benzoyl peroxide or a combo of tretinoin with clindamycin. But if you fall into the moderate to severe category, the game plan escalates. Here, doctors will actually add an oral antibiotic, a tablet like lamicycline or doxycycline, alongside your topical treatment. Those tablets are super vital here because they fight the inflammation from the inside out, and they can easily reach tricky, widespread areas like your back and shoulders that creams just really struggle to cover. Which brings us to what we call the golden rule in dermatology. You absolutely have to remember this. Antibiotics are never used alone for acne, ever. Whether it's a cream you rub on or a pill you swallow, a doctor will never prescribe an antibiotic on its own. And they'll never combine an oral antibiotic with a topical antibiotic either. They are always paired with something else, like benzoyl peroxide or retinoid. Why? One phrase: antimicrobial resistance. We absolutely have to protect our antibiotics and stop bacteria from mutating and basically becoming immune to the medications. And honestly, this timeline right here is exactly why so many people fail at clearing their skin. We just have zero patience. You start your treatment in week 1, but biologically speaking, you are not going to see any real noticeable improvements until weeks 6 to 8. What usually happens is people use a prescription cream for 3 weeks, see absolutely no change, get super frustrated, quit, and then go right back to buying those viral serums online. You really have to manage your expectations. You've got to push through to that 6 to 8 week mark and ultimately make it to that final 12-week doctor review. At 12 weeks, your doctor evaluates if it worked. If it did, they might actually stop the antibiotic pill but keep you on the topical cream just to maintain that clear skin.
Now, while those prescriptions are doing the heavy lifting, your everyday habits absolutely matter too. Let's quickly separate the facts from the fiction when it comes to skincare routines. Do wash twice daily with a skin pH-neutral Sendic cleanser. Do use oil-free, non-comedogenic moisturizers and sunscreen. And yes, please eat a generally balanced diet. But absolutely do not pick or scratch your spots. Seriously, that is a one-way ticket to permanent scarring. Also, don't rely on those super restrictive anti-acne diets you see online, because medically speaking, there just isn't enough evidence to back them up. And never, ever sleep with your makeup on. Just stick to the simple, proven habits. You do not need an exhausting viral 10-step routine.
We really need to shift gears for a second here because this next point is incredibly important, especially with all the insane social pressures young adults are dealing with today. Listen to this. Acne of any severity can cause real psychological distress, and this is taken as seriously as the skin itself. We completely want to validate your emotional struggle here. Having acne is just exhausting, and it can massively wear down your self-esteem. And medical professionals actually recognize this. They treat the psychological impact of acne with the exact same gravity and seriousness as the physical spots on your face. It is not just an afterthought to them. Because of that, I want to empower you to really speak up. There are major mental health red flags you absolutely must share with your doctor. Things like persistent anxiety, a constantly low mood, severe body image concerns, body dysmorphic disorder, or any thoughts of self-harm. If your acne is driving you to experience literally any of these, you have to tell your GP. Why? Because these symptoms warrant a direct, immediate referral to a dermatologist specialist or mental health services, regardless of how mild your skin might actually look on the outside. Your mental well-being changes what support options are offered to you. You really do not have to suffer in silence. Knowing exactly how acne impacts your mental and physical health is why you need to know when to escalate your treatment. You need the right vocabulary to advocate for yourself and demand a specialist. For example, if you develop something called acne fulminans, which is a really severe, sudden onset acne accompanied by bodily symptoms, that actually requires a same-day emergency referral. You also need a specialist for deep nodulocystic acne or acne conglobata. Or if you've already patiently completed 2 full 12-week courses of standard treatment and your skin still hasn't responded. And finally, if you're starting to develop permanent scarring or lasting discoloration, do not wait. It is time to ask your GP for that referral to a dermatology team.
And when you finally get to that specialist, there's a specific medication they'll often discuss with you, isotretinoin. This is the heavy-duty stuff. You might have heard of it by a bunch of different brand names all over social media, but it is so crucial to understand that isotretinoin is never, ever a first resort. It is strictly reserved for severe acne that has completely failed to respond to the proper 12-week courses of antibiotics and topicals we just talked about. It's a very serious medication where the dosing is actually based on your body weight, and you have to take it until you hit a specific cumulative target dose over several months to basically shut down the acne for good.
Because isotretinoin is so incredibly powerful, it comes with some very strict medical safeguards that you absolutely have to agree to. We're talking mandatory mental health monitoring before you even start and throughout the entire treatment. Doctors will also need to assess sexual function, but most importantly, anyone who could potentially become pregnant must enter a highly regulated, super strict pregnancy prevention program. This is because isotretinoin can cause severe, life-threatening harm to a developing baby. These safeguards aren't there to scare you, they are there to protect you, and it just shows exactly how closely monitored this specific treatment path really is.
Now, right before we wrap this up, it's really important to note that the medical approach is tailored to you. It's not just a one-size-fits-all situation. For instance, if someone is pregnant, they absolutely must avoid topical retinoids and oral tetracyclines, so doctors will immediately pivot to safer alternatives. If a young woman has PCOS, or polycystic ovary syndrome, doctors will still try the standard first-line treatments, but they might add a combined oral contraceptive pill to tackle that specific hormonal aspect. And finally, if the breakouts are actually being caused by a medication, like, say, a young adult hitting the gym and using self-administered anabolic steroids, the medical strategy is simply to directly address and stop that underlying cause. So, all of this brings us to the big question. Are you ready to ditch the endless scroll of internet trends and start your actual proven medical roadmap? Treating acne is not about finding magical overnight patches or buying a 20-step routine. It's about getting the real science, fully committing to those 12 weeks, and fiercely advocating for your mental health along the way. So the next time you're tempted to blow your money on a viral quick fix, just ask yourself, are you going to keep chasing a miracle, or are you finally ready to trust the science and take your skin back?